cesarean sections. Babies born via surgical incision in a mother's lower abdomen are on the rise, jumping by nearly 60% since the late 1990s.
And this is despite significant concerns from the American College of Obstetricians and Gynecologists and the Society for Maternal Fetal Medicine that the procedure is overused.
News 8 medical reporter Lisa Carberg is digging into what's driving the trend.
Pre-existing medical conditions, babies in the wrong position, and of course emergencies all contribute to cesarean rates. But according to the National Institutes of Health, a majority of first-time C-sections are for failure to progress, labor that doctors deem has gone on for too long. It's a moment a woman often dreams about her whole life, meeting her baby for the first time. But for 1/3 of women, labor and delivery turns into unexpected surgery.
They were like, yeah, you're gonna have to do the C-section, I'm sorry.
Cesarean sections are the most commonly performed surgeries in the country. More than 1 million moms every year wheeled into operating rooms, secured to the table, and cut open.
There's so much a blur.
Certainly if it's an emergency and it's a life-saving surgery that's needed at times, but we're overusing it.
Michelle Telfer is a certified nurse midwife who has been delivering babies for 23 years and has witnessed the jump.
It's gone up probably from 20% when I first started practicing to, in many places, 35%. In some parts of the country, it's up to 50%.
In 2022, just over 35% of births in Connecticut were via C-section, the fourth highest rate in the country and the highest of all the Northeast. The risks, damage to other organs, and a higher potential for blood loss. Allison O'Brien knows all about the procedure and its recovery. Her first baby was born via C-section when doctors decided her labor wasn't progressing.
The doctor checked and she said, okay, well, you've been at 6 centimeters for a while now, and I'm going to come back in an hour, and if nothing has changed, we're going to do a C-section, and that's exactly what happened.
The reason for Allison's C-section cited as failure to progress.
I think a lot of times it's really a failure to be patient. It is completely up to you and your preferences.
Hamden doula Ashley Minaham teaches childbirth classes and works with expectant mothers, frustrated seeing what she calls unnecessary C-sections for women.
You can say yes or no.
Who could continue laboring.
As long as everybody is safe and the baby's stable, they should be able to keep going.
Ashley worked with Allison on her second birth at a different hospital with a different provider. While her labor was similar, the outcome very different. A successful vaginal birth after C-section known as a VBAC.
The things that my body did in both situations were similar, but the support I had was very different.
Rates of C-sections vary widely depending on the doctor and the hospital.
Some providers are a little bit more used to doing surgical births. You can do a C-section in an hour, but somebody can be in labor and have a vaginal birth after 24 hours. And so a cesarean birth is certainly much quicker.
And much costlier. Yale New Haven's price estimator puts a vaginal birth without insurance at just over $24,000. A cesarean, more than $33,000, nearly $10,000 more expensive. Yale doctor Audrey Merriam says cost is not a factor.
That is definitely not weighing to the provider's mind, and I would say it's not even weighing to the hospital's mind, because from a hospital standpoint, they again are looking to do what's safest for mom and for baby.
Something that is on the minds of the healthcare providers we spoke to, lawsuits.
Malpractice is definitely something that's talked about a lot in obstetrics because our rates are pretty high.
You never get sued for doing the cesarean. You'll get sued for not doing it.
At the end of the day, in this case, a little one's birthday. Everybody agrees the goal is the same.
Try to take it on a case-by-case basis and say what's best for this mom and this baby in this instant.
Expectant moms can reach out to their provider to request rates of vaginal deliveries and C-sections, but it's important to note high-risk practices in hospitals will have higher rates because they treat unique situations. Lisa Carberg, News 8.